What would you say to someone who is thinking of becoming an OT?
Do it. It's the best profession ever.
Absolutely.
What other profession can you finish uni and say, I want to work in mental health, I want to work with kids, I want to work in the community, I want to work in a hospital, I want to work in an office. We have such diversity in what we can be as OTs, but I feel like it doesn't matter who you are, there's a role as an occupational therapist somewhere that absolutely meets your skills.
Hey Bianca, how are you?
I'm really well, thanks. Ally, how are you today?
I'm good, thank you.
What do you think is the most important quality of an OT?
I think it's probably a simple one, but I think that you have to be a compassionate person that loves to help people.
Yeah.
Like I said, with OTs, we are person and patient centred, and especially in the hospital setting, or in lots of settings, but particularly hospitals are incredibly overwhelming and people can feel very vulnerable, and I think if we can come in and be really compassionate and show empathy to the patient in that really challenging situation, then you know, no matter what intervention we can do, if we are demonstrating that compassion, it's at least going to have some positive impact, hopefully, on their hospital stay and whatever we do next. What about for you? What do you think?
I think there's a couple of things. I guess it goes hand in hand with compassion. Being a really good listener, spending the time to listen to the answers of the questions and to ask meaningful follow-up questions and to hear the person's story makes such a big difference for the person that we're working with, but also such a big difference in the rapport that we're able to build with them and the trust in that relationship. What do you enjoy about being an OT? Kind of what keeps you going?
The patients, obviously, that's number one, and seeing their growth and their development throughout their journey, and whether that's on the wards where I'm with them for quite a short time, or in hand therapy where some of my patients I'm seeing for 6 to 12 months. So I think just seeing that development in the patient, both physically in terms of their hand injury, I'm seeing the improvements they're making, but also there's a really big mental and emotional factor in some of the injuries that we see. What keeps me going is knowing that I get to see the improvements that patient makes, and I get to be that support for them and continue to encourage them, and then at the end, the end goal is getting them back and seeing them living their best life. I absolutely love it when a patient comes in and they can say, I had one recently say, this week I was able to braid my daughter's hair after 6 months of not being able to do that, and that was so important for her, and I just thought that was, they're the moments that I'm here for. Yeah, what about you?
Well, I guess when I was working clinically, it was the same as you. It's the working with the patients and the team to help achieve goals. And I guess now in my more quality and research role, it's about how we make sure that the service we're delivering at Eastern Health is evidence-based and is meeting the needs of our community. So for me, what keeps me going is continuing to read about all the improvements and the opportunities that we might have to improve our service, which in turn helps our community experience the best quality of care that we can provide as occupational therapists. Yeah.